So endocarditis, that is inflammation of the endocardium. The endocardium is what lines the heart and the surface of the cardiac valves. Remember, it's this thin layer right here. That's the endocardium, the inner layer. Usually you get this inflammation from a bacterial infection. And what happens is, let's say you have injury to this endocardium right here. Then you get a little platelet fibrin thrombus. And that's how bacteria can come along. Let's change the color. Let's make this bacteria. Bacteria can come along and adhere to this injured endocardial surface and grow. So that's how you get the bacteria growing, causing inflammation of the endocardial lining. Now, there's several associated bacteria with different clinical pictures. If you learn this, you can try to answer these yourself. If you haven't, follow along. If the patient has acute severe infection, this is termed acute endocarditis. Acute because it's acute, very rapid, very severe. Then it's most likely Staph aureus. If it's after a dental procedure and the symptoms are subacute, that is low severity, then the bacteria would be viridans strep. If the patient has associated colon cancer, bacteria is strep bovis. Finally, if the patient has prosthetic heart valves, that is, they had a valve replacement, then the bacteria is Staph epidermidis. Remember, that's the one that likes to. It's the one that likes to form little films on foreign bodies, such as prosthetic heart valves and prosthetic joints. Now, which heart valve is most commonly involved? The mitral valve is most commonly involved. However, if the patient is a drug abuser, then what valve is most commonly involved? It's the tricuspid. And why is that? Well, the way I think about it is, where do you inject your heroin? Do you inject into your veins or arteries? You inject into your veins. Those are the stuff you can see, the blue stuff. Those are your veins. And where do the veins go? Well, veins are going to go to the right side of the heart. And which valve is to the right side of the heart? Well, that's the tricuspid valve. So that's why drug abusers have tricuspid valve involvement with endocarditis. And the most common bacteria here in drug users is Staph aureus. Alright, so let's talk about clinical features. There's a couple that we can break it into. First aid is a mnemonic if you like. There's infectious symptoms, because this is an infection, it's bacterial caused usually. So, what symptoms do you have an infection? You can just think about when you had an infection. You get fevers, you get chills, you don't feel good, that's malaise. So the acute infection, which we talked about, what bacteria caused that? That's Staph aureus. Acute infection is high fever and they're severely sick, and it happens in a couple of days. Subacute, what bacteria was that from? That was viridans strep. That is a low grade fever, so maybe 101, not too high, and it looks like a flu. And they've been sick for over a week. It's kind of low grade, it's just simmering. It's a simmering infection. The next thing is you can have thrombotic or septic emboli from vegetations on the valves. So these emboli grow on the valves. So let's say this is our heart valve. Heart valve. You get these little emboli growing. Okay, emboli. They grow, these vegetations, and then they can embolize. They can shoot off out of the heart into the rest of the body. If they shoot out into the eyes, you get Roth spots. If they shoot out into the fingers, you can get Janeway lesions and Osler nodes. Or you can get nail bed hemorrhages, splinter hemorrhages. So Janeway lesions are you see on the palms. They're non-painful. Osler nodes go on the fingers, and they are painful. Okay? You can have other emboli. If you have a tricuspid valve, what's the next thing that goes after the right heart? You go to the lungs. So you can get emboli into the lungs. Okay, so next is mechanical cardiac injury. So imagine you have all these bacteria here causing inflammation. You can damage these valves. And then, as you can see, these valves aren't working very well now. So you can get regurgitation. You can get blood going from the ventricle and going back into the valve. So if it's the mitral valve involvement, you get mitral regurgitation. If it's tricuspid valve involvement, you get tricuspid regurgitation. Finally, the last thing is immune injury. You can develop antibodies and antigens that are going to form complexes, and they're going to deposit in various parts of the body, including the kidneys. And when this complex does that, when depositing in the kidney, you're going to get something called glomerulonephritis. So that's it for all our symptoms. It's pretty simple. It's just infectious symptoms you would expect. And then just remember that your bacteria on the valves, they're going to grow vegetations that can shoot off and cause this spectrum of symptoms. Or they can just damage the valve and you're going to hear a murmur from regurgitation. And finally, you can have immune injury. So that's it for endocarditis.